One of the questions or points of confusion that I'm often talking to parents about in our feeding series, this is continuing our feeding series, is how does feeding relate to sensory? And oftentimes parents will say, my child doesn't really have any sensory issues. And I'll say, well, what's their diet like? Well, they eat these 5 items. A lot of times the limited diet is a sensory based issue. And I'm just going to give you a few pointers to think about. When we have tactile or touch issues in our body, it's in our mouth. It's not a separate part. We're all one piece. So think about that first of all. Some of our kids don't like certain textures. Some of them don't like things that are salty. Some of them don't like things that are sweet. A lot of them have bilateral issues. Many of our kids, when they chew food, they only chew food on one side of their mouth because they can't integrate both sides, and there are weaknesses in their mouth, just like we have in our core or in our body, not being able to cross midline. So just because it's here and not here, it works together. A lot of our kids have motor planning issues. They aren't able to chew properly and properly move that food down into their throat and swallow it. We have a lot of kids that are lazy eaters. They'll want to, we call it the chicken nugget diet. They'll want to eat what we call pre-digested food, those soft foods, cheese, nuggets, French fries. They don't want to eat items that force them to chew and work on a tendon or are going to require work because they have strength and motor planning issues. So remember that the mouth is part of the rest of the body, and feeding is part of that whole process. And I also tell parents it's really important. Feeding is a highly social thing we do with people and with our families. So we want to work really hard on making sure our kiddos are integrating in their mouth as well as they are their body.